If your dog has a sore nail, is limping, maybe licking that nail bed, he or she may have a nail bed infection. In this edition of Veterinary Secrets, I'm going to be showing you the top natural remedies to treat your pet's nail bed infection at home. Hello you guys, welcome back to my channel. For those of you who are new, welcome. First, thanks for so many of those kind comments from the last video. It was a hard video to make and even just a hard thing to go through. So first, thanks for all those super supportive comments. A nail bed infection. First, I want to just show you Tula's nails so you're really clear on what I'm talking about. And then in short order, we're going to go into all the natural remedies. So there's Tula in a close-up. Good girl. It's a little harder to see her nails because she's got the black fur. But I'm going to zoom in here with the camera. Here's her front left paw. And she's pretty good. She's really crazy about me poking her nail bed. So you can see here, her nail's actually a little bit, oh, good girl Tula. So here's her nail bed right here, right where the nail comes out. So there's a little fold of skin around it. As you can see there, when I pull the fur back, we can see it by my finger. Good girl, little Tula, let's just show them. And in an infection, that would be swollen, typically red, and often there'd be a fair amount of discharge. So my first big point is, if your dog is limping or your cat is limping, they appear like they're licking the paw, just first have a good exam. See what's going on. Why are they licking? Is it their pad? Is it their nail that's been split, or is the actual nail bed itself? So if you see that it's swollen, red, inflamed, there's discharge, likely there's a nail bed infection that needs to be investigated and then treated. The most common reason why the nail will be infected is there's a bacterial infection. Your dog may have an underlying allergy, there may be some injury. In some of the lesser common cases, perhaps there's an autoimmune disease, doesn't happen very often. Perhaps it's a fungal infection, that doesn't happen very often, much more common in people. And or in some real unusual cases, there can even be a type of cancer that's causing that rapid swelling, where it's very painful. So first of all, if you're not sure at all, go take your pet in to see your veterinarian and get a diagnosis. But if we're dealing with some of those pretty common signs, likely it's a nail bed infection, and let's go in and talk to some of the treatments. So the first thing, it can be really painful before you're going to be able to get a good look at your dog's foot or your cat's foot, is offering them some type of pain relief. So they're going to let you have a look at it, and it's not so uncomfortable. So if you happen to have your dog or you're on an anti-inflammatory, that may be an option. You could give him or her a tablet of that. You could look at something over the counter. If we're dealing with dogs, we could be looking at aspirin. The dog aspirin dose is one 325 milligram tablet for 40 pounds of body weight. So you give one of those about an hour before you want to do the exam. Assuming your dog is not on a prednisone, a steroid, or any other anti-inflammatory. Or you could look at giving some type of natural anti-inflammatory. The one I really like the most is this one, Curcumin here. And when we're looking at a typical dog or cat dose, so it's safe for dogs and cats, we're looking at 100 milligrams per 10 pounds of body weight. So you want to give that a good hour before you're going to sort of try and do the exam of the nail bed. So here's my medium-sized bowl. Or a little Tula, here, a cup of black tea. Oh, good girl, Tula. She knows something's going on. And it just means soaking your dog's foot in it. You could also use an antiseptic such as chlorhexidine. It's okay, it doesn't hurt. We're just going to soak. So you just stick your dog's foot right in it. Good girl. Good girl. We're just going to pretend soak your swollen digit. Good girl. Make it lukewarm, it's not too hot, and so put your finger in first to test it. You want to soak that for at least a minute. Ideally, somewhere like 4 to 5 minutes. A long period of time, because we're really trying to loosen up the debris, loosen up the swelling, start drawing out some of that infection. And that can be safely done. You can be doing that twice a day, and that's sort of the mainstay. That's soaking it twice daily. You're going to be doing that somewhere between 7 to 14 days. Third, you can look at giving some type of natural antibiotic. In my experience in vet practice is the majority of dogs that had these really serious nail bed infections, most of those needed to have some type of antibiotic because you had this deep infection that penetrated underneath that skin fold or the nail bed fold, and it became infected. So it's just a hard thing to treat. But first of all, soaking is going to make a huge difference, especially if you're diligent. You're doing that twice a day. And each time you're putting in, fresh black tea, for instance, and really being thorough about that, really soaking it, maybe even massaging the nail bed. So then thirdly, if you're going to use some type of natural antibiotic, if I were to use one, for instance, on Tula, it'd be this one here. It's the Aloe. So this is the active ingredient that's found when you actually crush garlic, and you're to give that orally and take that orally. When we're looking at a dog dose, we're looking at about 100 milligrams per 10 pounds of body weight in total daily. So Tula's dose would be about 200 milligrams. Each one of these tablets is 1,000 milligrams. So to give it to her, we only be looking at about a fifth of a tablet. I'll just show you how big they are. So there it is here. There's the garlic or the allicin. And you could sort of approximate it and give her about a fifth. A quick side note, it's written all over the internet, all about the toxicity of garlic. I've never ever seen garlic toxicity in veterinary practice, and if you want to go ahead and do some research, you're going to see it's not documented. One of the big studies that referred to it talked about garlic toxicity, and they were giving the equivalent of 60 garlic cloves a day to a 75-pound lab. So it's a huge, gargantuan amount, and if you or I to take that much, we'd have signs of toxicity. When we're looking at these much lower levels, such as I just discussed, 100 milligrams per 10 pounds of body weight daily, you're not going to run into toxicity, and more than anything, it's going to provide some pretty positive benefits for your dog. So to begin with, we know honey is a really impressive and effective antibacterial. So you could just put it directly on to your dog's infected nail bed. I'm going to try it here with Tula, see what she thinks about it. Tula. Go girl, you. So ideally, you're getting unpasteurized honey. And in doing that, we know it's going to have more antibacterial properties. It hasn't been exposed to high heat to denature some of those enzymes. So you're just, ideally, it's more of the liquid formation. You're just putting that right onto that nail bed. Good girl, you. Yeah, it might seem a little bit sticky, and if you can sort of get it, the more liquid the honey is, the better. And you almost want to sort of immerse, that all around the circular end of the nail, right where the nail joins the skin, and try to get that honey almost to ooze in under the edge of the skin, because then we know it's potentially going to be more effective. So there's topical honey, or you could do it in combination, also give it orally. So something like Tula, she's 20 pounds, I'd be giving her about a teaspoon of honey, and I would do that daily. Because we also know, why not stimulate her immune system systemically as well as applying it topically? It can do no harm and potentially do a whole lot of good. Good girl, Tula. Plus she likes honey. Good girl. There. See? It's not all bad being on videos. The fifth one is vitamin E. It's a great one to stimulate your dog's immune system, and it can be given orally as well as being applied topically. When we're looking at oral doses, we're looking at 100 international units per 10 pounds of body weight daily. And then topically, it often comes as a fatty acid capsule, or you can just get it as a liquid drop. So you could drop it on directly on to that infected nail bed. Safe to do, may be quite effective. There's a plant that many of you may have in your house, and it could really be helpful for these surface and nail bed infections. So here it is here, an aloe plant. Aloe is one of those sort of great foundational natural remedies, which is especially helpful for any of the skin disorders, majority of the topical infections or skin disorders, period. So if you're going to use the plant, fresh plant, I would just break off a tip, which we got. You can see it here. See what it oozes out? I'm hoping you guys can see that. That's almost clear as gel. But you can directly apply that to the infected nail bed. You can also you can go to a natural health store. You could actually purchase aloe in a gel formation that could be applied topically. But ideally, you're just going to have yourself a plant. I mean, it's super hardy. I completely ignore this plant. It keeps thriving. It's kind of my ideal plant. Let's go to Tula's imaginary nail bed infection. We're going to squeeze some aloe juice on that. Good girl, Tula. Wow, you're going to have one healthy nail. You'd be looking at applying that twice daily, somewhere between 7 to 14 days. So this would be a good one, which is antibacterial as well as being naturally antifungal. And you're gonna likely have these ingredients in your house. So what I've done is brew up here a pot of green tea. And I want you to just to put in a half a cup of green tea. So here's part of our compress. There's the half a cup. I want you to use apple cider vinegar. And with it, you're gonna use 1 tablespoon of apple cider vinegar with that half a cup of green tea. All right. And then lastly, I have this essential oil from Young Living, frankincense, which smells wonderful. Also works really well as being a topical antibacterial as well as antifungal. But we're going to dilute it. So we're just going to put 5 drops. There's 5 drops of that frankincense essential oil in this combination. So we're giving it in a real diluted form such as this. Together it's safe. That can really be helpful for these nail bed infections. As I said, the majority of times we're dealing with a bacterial infection. In some cases it can be fungal, and using the apple cider vinegar along with the essential oil will also be antifungal. So once again, you're just going to be soaking your dog's foot in that combination, really working on that nail bed. Good girl, little Tula. And you want to soak that ideally for 5 minutes twice a day. Minimum 7 days, more like 14 days. There, little Tula. How's that? Ooh. Actually smells pretty good. Good girl. So thanks again, you guys, for watching this edition of Veterinary Secrets. I'd love for you to click down there to like this video. Click up there to subscribe to my channel. And lastly, I want you to click that link directly in the box below. And then when you do that and you sign up for my newsletter, I can send you my free books and my free videos on how to heal your pets at home with my top natural remedies.